So good morning, everybody. Welcome to Casualty 911. And it's a pity that last week I could not make it, but today we have a very interesting topic. Let me say good morning to all our listeners out there, especially Soufriere and Environ, Choiseul, Canries, and whoever that is listening online, or those persons who take time to look at the show after on YouTube. Um, Good morning to you. I hope this week will be a wonderful week. It has been very, very hot out there, so don't forget to drink your water, stay in shady areas, and just be mindful of the heat. So this morning, last 2 weeks, we had Dr. Eugene Ford who spoke about the programs that UHC offers. And today we want to talk a little bit more about one of these things that UHC offers, as well as this month, September, is known as Prostate Cancer Awareness Month. Now, during my time out there on the field, I'm normally speaking to the men about prostate cancer and the services that are available. And that is why I chose this topic today, because of the different response that you get. And I feel that persons need to be a little bit more open-minded or to create a little bit more awareness about prostate cancer. Whereas many of us feel we are young, vibrant, we don't have an issue. This is not an issue we look forward to. But reality is the medical condition is there and it affects men. And that's why we're asking the men to come in and to come to our men's health clinic, or you can go to your private physician and do a general checkup. That's all we're asking. And we're asking certain things also, maybe to change their lifestyle, because there are many risk factors that relate to prostate cancer. So this morning, the topic is prostate cancer, and the theme for Prostate Awareness Month, Cancer Awareness Month, is bringing empathy back. And bringing empathy back means coming in, doing your check, your screening, and if in the event that there is cause for concern, you go through the right channels, the way to do things, seeking medical advice, taking the medical advice and doing what you're supposed to do, and making sure that you continue living a healthy life. All right. So again, prostate cancer is definitely a global issue. It's not only tailored to St. Lucia or the Caribbean, but it's a global issue, especially for our men. Now, why we have all this hype about prostate cancer? One of the reasons is that 1 out of every 8 men will receive prostate cancer diagnosis in their lifetime. So who knows? It might not be you, it might be a brother of yours, it might not be anybody in your family, but it might be a friend of yours diagnosed with prostate cancer. And why the awareness? Better outcomes with early detection. So early stage of prostate cancer shows no signs. And many people think, okay, the men think, oh, I'm getting an erection. A gentleman told me, oh, he doesn't need to do the prostate screening, cancer screening, because when he goes out and urinate, that shoots, So all of these little things that you get when you go out there and so on, because, persons do not understand why it is important to do the screening and why it's important that you do the screening at a very early age, at the prescribed age. All right. So Regular discussions and screenings can catch the disease early, and that is why you have me speaking to you all the time, especially the men. I do speak to women about prostate cancer because sometimes what I feel, if one person is sick, if the man is diagnosed, the women in the house or the children in the house, it becomes their responsibility to take care of that individual, to provide support. And that's where empathy comes into play. Provide that level of support to your family member, be it financially, listening to that person, encouraging that person to make sure that they take the medication that is prescribed, making sure that they go to the doctor on their appointment dates, or going with them for that level of support. This is what it entails. So that empathy goes a long way. Yeah. So, and we're looking at why the awareness. The awareness is targeted risk factors. So men over age of 50, those with African or Caribbean heritage, and men with a family history or genetic predisposition face higher risk and benefits most from early detection and screening. So why the awareness? The awareness is we targeting those that have the risk factors, the African men, Caribbean heritage, the persons with the family history, and later on we'll go about talking about the family history, and ensuring that those that are a higher risk go and do the early screening for early detection. Yes? So that is why sometimes I speak to family members and especially the men. And that's why I always tell the wives, the girlfriends, it's not what you tell the gentleman, but it's how you say it to them. So if you want to encourage your partner, your spouse to come into our men's health clinic to get the free prostate exam, you have to tell it to them in a way that they can understand. It's true, sometimes men could be hard in hearing, but convincing takes a lot. So behavioral change don't change overnight, but you have to continue encouraging. Yes? And treatment and the quality of life. So part of it is, now you see me doing the education, and now with the free prostate test, the free PSAs, and the men's health clinic being offered at so many different wellness centers now, is part of active surveillance that they're actually offering. So now they're giving you an opportunity to come in, do the test for early detection. So that part of surveillance helps quite a bit. And by doing this, early detection, like Dr. Eugene said, after the PSA, they're offering the biopsy at ancillary. So they have that level of monitoring and that level of support, and they have the urologist there to support you through it all. And if anything, we have our mental health team, because sometimes when you diagnose or there is an issue there, you need a level of counseling. That is where we have our mental health team to help you through it all. Yeah, both you and your family members. And the care for the caregivers. Prostate cancer affects not just patients, but also families, partners, and support networks. So the Awareness Month advocates for carer support, open communication, and shared resilience. And that's just what I was saying. Family support is important, as well as the counseling for those persons that is taking care of the cancer patient, as well as the patient being diagnosed. So all of that ties in nicely with Prostate Cancer Awareness Month. And that is why we have that hype about prostate cancer, because sometimes people don't understand what you are going through when you are diagnosed with cancer. People do not know the extent of it. People don't feel your pain. People don't understand your level of thinking sometimes. And persons that are taking care of you sometimes are not very patient. They'll feel that you're complaining all the time. They feel that you're crying all the time. And these are the issues that persons go through. And that is why sometimes when you're sick as an individual, you have to be able to communicate with persons openly. And, not the shouting, not the quarreling, and so on. So by communicating openly, it makes things much easier for the carer as well as the patient. Yes? All right. So, how to get involved, because this month is Prostate Cancer Awareness Month. So how you as a man should get involved in everything that is going on. We have our men's health clinic, Soufriere Hospital, every first and third Wednesday of every month. We have all our medical clinics at our wellness center. Lafag is currently closed. So we have Magouche, we have Etangs, we have Delse, and we have Fongejac, we have Conries. We have all these health centers have their own medical clinic. So if you don't want to go to men's health clinic, you can come to our medical clinic. You can find out from the health center when is their medical clinic. So for Delse, it's Monday morning. For Magouche, it is Tuesday morning, and Etangs Tuesday afternoon. Fongejac, it is Wednesday morning, and of course, Lafag is closed, but it's every Thursday. And you have medical clinic every single day at Soufriere Hospital. Yeah? So, and Canary is Tuesday morning. So, get involved. Go to your doctor, speak to the doctor. Or you can go to your private physician. That's not a problem. Yeah? For persons 40 to 45 with high risk factors, should discuss the PSA with your doctor as well as the digital rectal exams, and we'll talk about that. For early testing and to increase the early diagnostics, for early testing. So by doing this, they can diagnose you very early and everything might just work out to your favor. Yeah? So for persons, wider awareness for persons with prostate cancer. I'm sure on the radio program you have seen many times we have persons that gives testimonies. This month or last month we had Kirill doing his journey as a sickle celler. And you too, if you have prostate cancer, you can speak to other persons that is going through it, that are newly diagnosed. Tell them your story. Tell them how did you feel, the family support. Share your experience with these people. You understand? So, so that these stories can reduce fear in those people and encourage others to act. By doing this, you encourage other persons to go and do their early screening, because now that they have heard your story, they know the situation. So there is nothing to be afraid of. And, so they might decide, okay, I'm coming and do the test. And one of the things that we realize is that we don't see many of our 40 years to the 50 years coming to the wellness centers to do the prostate. And this is what we encourage, the PSA, sorry. This is what we're encouraging our younger generation to come in and start doing. So by doing this, I remember Dr. Maki was saying, when you start so early, when you do the PSA, you know you have a marker by which you go by. So if your PSA was at that number, the doctor tell you come back in the next year or 2 years, you see it's increased, then you say, then you know there is need for concern, or the doctor will guide you accordingly. But if you have never done it, and you wait when you're already 60 something to come and do the PSC, you do not know what it was like before. So you do not know if it has grown, if there is a problem, there had been a problem for many years and you were not aware, and so on. So these are the type of things we want persons to come in. That's why early detection and the screening is very, very important. So that is why this month it is Prostate Cancer Awareness Month. Now, before I start telling you all about prostate cancer, first thing that comes to, and I had to do some research, and I remember Dr. Eugene was saying about it. And first thing, main thing is, if you're having like the myths and misconceptions that if you're having sex frequently, you will not get prostate cancer. Now, if you know our Caribbean men do love sex. So having sex is part of their lifestyle. So I had to research this one for you. And it says, is there research to support the theory that frequent ejaculation reduces the risk of prostate cancer? So, you know, men are garçon, ou pas prostate cancer, là, ou savent, ou toujours kani sex, so, pas worry quoi, ça, pas besoin faire ça. No, I made it my duty. Yeah? At this time, so that's what it says. At this time, there is no conclusive evidence that frequent ejaculation reduces the risk of prostate cancer. So, pour abouez, la bani yon kadi sou kani sex on chay ou pa ka hen cancer prostate. So, même sou ka fay tous les jours, la still ni yon chance ou pe sa hen cancer a prostate. Okay? And I will tell you some of the risk factors. So before we go on, they say some studies have suggested that men with a higher frequency of ejaculation may have a slightly lower risk of prostate cancer. However, this difference appears to be small. So very, very small. So don't think maybe you're the lucky one out of the millions that has sex very frequently will not develop prostate cancer. So that is why early detection is key. So other studies haven't supported this conclusion. So that little part about the small things, there are not many studies that will support that one. So in a nutshell, having sex frequently will not reduce your risk of having prostate cancer. So I make sure I explain about avant moi do ki sa ki prostate cancer, because on shine on unless sa yo ka depend. And I do not want you to, concentrate on that part. Like we said, like Dr. Eugene said, the PSA test is being offered for free. Free of charge, that's the blood test. And we'll speak about it in the long run, yeah? So, what is the prostate? A lot of people hear about prostate gland, but have they ever looked up, go on YouTube and type in the male reproductive system? And on YouTube, type in male reproductive system. Et puis te explain ba ou ki sa male reproductive system lan ye, et puis ki manye male reproductive system lan ka travay. So go on YouTube, look it up. Look it up and it will tell you how that works. Yeah? How the male reproductive system works, and what happens. Yeah? So then you can know how it works and the functions of it. Because many times people don't know their body. You have to learn your body. And that is why I ask you, take some time. And then it will show you the male reproductive parts. It will show you the different parts of the male reproductive system. As well, it will show you where the prostate gland is located. Because many people say, tube moi bouché. And they say all these things. So you'll see where that tube is, you'll see the name of the tube, and it will show you when the prostate gland is enlarged, what happens to that tube. So take some time and, do a little research and know about both men and women, not only men, but both men and women, because sometimes the men will watch it and the women might be able to explain to you better, or you might even be able to explain to the women better. It goes both ways. Yes? So the prostate is a part of the male reproductive system, which includes the penis, prostate, seminal vesicle, and the testicles. That's what you call your balls. The prostate is located just below the bladder. That is why when you have issues with your prostate, you're having issues peeing, when you're urinating. And in front of the rectum. You know what's the rectum? Yes, that is exactly what it is. So that is why the doctor is using the digital rectum examination, where they push your finger, because it is so close to it, so they can actually feel the prostate gland. Yeah? It's about the size of a walnut and surrounds the urethra, the tube that empties urine from the bladder. So I'll say that again for you to hear. It's about the size of a walnut and surrounds the urethra. So your urethra is the tube that empties urine from the bladder. So that is why sometimes you're having difficulty peeing when you have issues with your prostate. Now, when you have issues peeing, that doesn't mean it also always relates to having prostate issues. But in the context of the prostate cancer we're talking about, or issues with your prostate, that's what happens because of where the bladder is located, as well as that small tube. That is why we're having issues there. It produces fluids that makes up part of the semen. Yeah? And a lot of men, because they get an erection, they feel they have no problems with their prostate. If you take some time and you read, then you realize at what point in time you might have difficulty getting an erection when you have problems with your prostate. Yeah? So not because you can get an erection doesn't mean there is not a slight enlargement or there is no reason to come in and do the test. Yeah? Erlen, are you feeling me? Erlen, I don't believe Erlen. Erlen, that is so integral. Yes? So, as a man ages, the prostate tends to increase in size. And I keep on telling men that. That's just a natural process. The gland will increase in size as you age. That is why you need to come in and do the test. Don't be afraid. First thing that comes to men's mind is the digital rectum examination, where they push the finger into the rectum. So as if once you hear that, that's the first thing that comes to mind, like all for long, they're not interested. But now they're offering the PSA, that is the blood test. You can come in and they'll do the blood test for you. So don't be afraid. Yeah? Good. So what are the symptoms of prostate cancer? Alan is, Alan is laughing because I hail up to him and say, difficulty starting urination. So you want to pee, it's not coming out. You want to pee, it's not coming out. So you're trying to concentrate to make that come out. Weak or interrupted flow of urine. So that is why the gentleman tell me, by the time he put that out, that's shooting out. So he feel he doesn't have an issue with the prostate because that just... So weak and interrupted flow of urine. Before when you were younger, that used to shoot out. But now when you start, it's reaching by your feet. So you don't have that strength like before. So all of that happens. And that is natural for men. I mean, we women go through a lot too, but that part is natural for men. Urinating often, especially at night. So then you have trouble emptying the bladder completely. So after you finish pee, you just finish pee, but you still feel you want to pee. As if the bladder has not been, you still feel that you want to pee. Pain and burning during urination. Blood in the urine or semen. So that's one thing you have to look for. So some men you see it, some men you don't. Pain in the back, hips, or pelvis that doesn't go away. Like someone say, normal do. All of that. And they try to justify why they have that maldo. So, and then they say it's heavy things, or they have worked hard all their life, and all of these kind of stuff. But these are some of the things, and painful ejaculation. So they said, keep in mind that these symptoms may cause by conditions other than prostate cancer. So sometimes you don't have prostate cancer, you have some of these conditions. Or you might have prostate cancer and you have these symptoms. Yes? So that is why you need to do the screening to make sure that you don't fall into that category of prostate cancer. So it can be another condition, but when you do the test, it phases out prostate problems and prostate cancer. Yes? So the key point here is different people have different symptoms for prostate cancer, and most men do not have symptoms at all. Remember earlier on, I said why we want to create the awareness, and one of the reasons why we wanted to create the awareness is that we said, I think I mentioned it again, that sometimes you don't show you have signs of prostate cancer. Yeah, I can't remember where I read it, but these are the things you have to do. Yeah, so that is part of it. So you feel you in your 40s, you're on to 45, you still strong, you can go on strong, but don't forget the prostate gland, the natural process that enlarges as you get older. So that is why you need to come and do the screening. Yeah? So cancer screening, and why we have the cancer screening means we're looking for the cancer before it causes symptoms. So by the moment you see the enlargement, when you do the screening, so before it starts showing you the signs, when things start showing you the signs, like you actually seeing the signs, that means you're up for a long time at the doctor's office, treatment, medication, and all of these things. So Once you do the early screening and you're not actually seeing the symptoms, that is where early detection comes in. Yeah? So, and the thing about it is, when you do that, you already getting it before it spreads. And a lot of people, that is when they normally detect the cancer, when that's already spread. So you can really imagine the discomfort and everything else, the shock that you get when you diagnose to say you have prostate cancer and that's already spread. And you know you have to start this treatment, you have to go for biopsy and all of these things. So that is when you really start thinking, and that is when you're always in a doctor's office. It's the same doctor office you never wanted to enter. That is your second home now because you have appointments over appointments over appointments. Yeah. So we were talking about the PSA, that is the prostate specific antigen. So these are the cancer, the tools that they use. There are other tools, but these are the first set of tools that they use, is doing the PSA and the digital rectal examination. So the digital rectal examination is where the healthcare provider put on some gloves and they lubricate their finger into the man's rectum to feel the prostate for anything abnormal such as cancer. So when the doctor tells you relax, he means relax. Because many men, when the doctor, most male doctors, their hands are even smaller than mine because these people just writing pen and paper and so on. And that's what I always tell people. So, but when they put on the gloves and they put the lubricant, the thing's supposed to slide. But knowing men, they tighten up themselves. That's why they ask you to relax. They tighten up themselves. And so now the doctor have to tell you relax and try to apply a little bit more pressure. But if you are just relax yourself, so that is what a lot of men are afraid of. They say they feel violated, they feel this, they feel that. But trust me, if you're diagnosed with prostate cancer, they will do it to you. The same thing you did not want for early detection, that's what they will have to do to you. And more things to come. So, the treatment and all of these things when you diagnose with prostate cancer. So that is why a little 2 minutes, a 2 little minutes of discomfort is nothing compared to a person that is diagnosed with prostate cancer and has to go through the treatment regime. Yeah, it's true. You whole night you probably might not sleep because you say, my goodness. But at the end of the day, that's nothing. Right, Erlen? Oh, yes, rightfully so, Erlen. It bruises your ego. And that's what it does, That's what the men have. It bruises their ego. They feel violated. But that has nothing to do with being violated. That's your health. Yeah? And then we have the prostate-specific antigen test. That is the PSC, where you have the blood test. Okay? And it measures your level of PSA in the blood. The PSA is a substance made by the prostate. So, how they detect it? So, men with prostate cancer, the PSA level in the blood is higher than normal. Higher with men with prostate cancer than normal men that does not have anything. So that is why they will, if you have your PSA at certain levels, they will send you for further testing. Further testing because there are other things that can cause a high PSA level. Yes? So some things that can cause a higher PSA level is certain medical procedures, certain medications, an enlarged prostate that can cause that, or prostate infection. Specific food, healthy food, your diet and exercise. You can, your veggies, you, as soon as you eat like a healthy meal every day, like you reduce, you stop smoking. So one of the risk factors is obesity. So you know you must not eat foods high in fat content. You eat your, half your plate with your greens and so on, your peas and beans, your legumes, your fish or your meat. Yeah, you can eat your red meat, but everything is in moderation. Like some men like to eat a bowl of meat, man. Like they're eating barbecue, a bowl of barbecue, a bowl of fish. There are more salads on the plate than food. But the veggies, half of your plate with your veggies, your peas and beans, your meat or fish, and so on. Yeah, but some people like to eat, fatty foods like the mac and cheese, um, the lasagna, fried fish, fried chicken. All of these things have to be eaten in moderation. Like some men, their belly big in front of them, but they get been so that. You know, I mean, your weight is important. Both men and women, your weight, obesity is one of the risk factors for prostate cancer. I don't know. Like, so Ellen doesn't have a big belly, so Ellen have nothing to worry about. But your weight plays an integral role. And let me tell you, losing weight can be very, very difficult. I am a product of that, trying to lose weight, and every day I'm on the scale, and it's like, but I realize increasing my vegetable content, especially my green leafy vegetables, works wonders. Yeah. And the bread, I stopped eating bread and all this pasta, and it's working wonders. So you have to really look at what you're eating, watch your diet. So Erlen asked me, I mean, what kind of food? And that thing about what how do you call it? Like food just for your pennies. You know. So I mean, I do not know how scientific value it has, or but
everything men eating right now is for the TV.
exactly. And that's what they think of. Everything a man eats nowadays is they think of their penis. And that is one of the things. Sometimes you have to think of eating a well-balanced diet. Yes. Make sure you eat a well-balanced diet. So again, remember the procedure for the PSA at our men's health clinic. You come and see the doctor. They give you the referral. The nurse writes the voucher for you, and you can do your PSA test. Yeah? And then after you get your results, you come back and see the doctor, and then they take it from there. And it's as simple as that. Free of charge, all you need to do is to make time. So, for example, at Soufriere Hospital, where they have the men's health clinic, what you can do, you can go to primary health care, where Magella, Fidelia, and Sabina, that side, and you can ask them to make an appointment for you, or they'll tell you come in because there are not many people with appointments, and they'll take it from there. All right. Most times there are male doctors that are doing the men's health clinic. So there is nothing to worry about unless you request a female doctor yourself. which I highly I doubt that somebody will ask for a female doctor. But if anything, you can always come in when there is a female doctor there. Yeah. But most times before they do the digital rectal examination, the DRE, they normally do the PSA for you. And don't be afraid when you come and see our doctors, our physicians. Don't be afraid to speak to the doctor. It's not always about the prostate, but there might be other issues that you might be having. Feel free to speak to the doctor and be open and honest, so that whatever that might be troubling you health-wise or mentally, they can guide you. If you have your questions, ask your questions, because at this point, you already reached there, you might as well ask certain questions. Don't be afraid, because one of the things is that when you do that, the doctor can guide you. If the doctor cannot help you and he needs to send you to a specialist, he will give you a referral. And again, when you get your results, that's one thing. You come in, you do the test. But when you get your results, and I always say that to people, when you get your results, do not be afraid to question the doctor. Doc, where do I go from there? You understand? Do not run home, start thinking, or you tell a friend that, and the friends are giving you all kinds of bush medicine and you don't want to go back to the doctor. If you want to take your bush medicine, speak to the doctor about it. If you feel that it's affecting you mentally, we have our mental health clinics. Come in and speak to the mental health nurse. All right? Don't go home and start thinking, and then you start losing weight, or when you sharpie, all they can see is your head. You lose weight, you get so small. Everybody say, guess what happened to you, sick man? Guess what happened to you, sick man? How you lose so much weight? Just like that, you're doing yourself that. There are services available to help you through it. Now, the thing about men is by the time they hear they have an issue with their prostate, the first thing that comes in their mind that they're not getting an erection again just now. But the mind controls the body. So don't be afraid. Other men have gone through it and they live a healthy life. Yeah? So, it does not work like that. I can tell you that. So, it's one step at a time. So the other thing, remember, Dr. Eugene spoke about the biopsy, and that could be done at Ansari Wellness Center. So if needs be, the doctor refer you to do a biopsy. It's available at Ansari Health Center, where they do the appointment for you. And that is a procedure that can be used to diagnose prostate cancer. So the biopsy is when a small piece of tissue is removed from the prostate and looked under a microscope, to see if there are any cancer cells. So the biopsy is another way of, detecting prostate cancer. And by doing this, after the biopsy, then you know, okay, I have prostate cancer, I don't have prostate cancer, and this is whatever. So the biopsy is one of the main tools for diagnosing prostate cancer. All right. There are other tools that can be used, but for now, we're concentrating on the digital rectal examination, although there are question marks about it, how accurate it is. There is the PSA and there is the biopsy. So the biopsy is the main tool for diagnosing prostate cancer. And if prostate cancer is diagnosed, other tests are done to find out if the cancer cells have spread within the prostate or other parts of the body. So after you have gone through these and you do the biopsy, and the biopsy said, okay, you have prostate cancer, then they will do other tests to find out if the cancer has spread throughout the body, other parts of the body, or it's always only within the prostate. So in doing that, you know where you stand. And then you speak to your doctor, or your doctor will speak to you, and then they will tell you your treatment options. That is, well, when we reach the treatment options, we're not going to speak about the treatment options because I'm hoping that persons will not reach that stage. And when they reach that stage, the doctor will better guide them. Yeah, and I don't want to scare people for them not to, you understand, go and do what they're supposed to do. So remember we spoke about family history and the genetic risk factors. So some men with genetic factors are at higher risk of prostate cancer than others. So sometimes if you have a first-degree relative, like father, son, or brother, who have had prostate cancer, including relatives in 3 generations on your mother's or father's side of the family. So if you have mother, father, brother on mother or father side that has prostate cancer, or 3 generations, uncles, so therefore you might be at risk for prostate cancer. If somebody so close to you has had prostate cancer, you're at increased risk for prostate cancer. Yeah? Another risk factor is family. If you were diagnosed with prostate cancer when you were 55 years or younger, so you're at the risk of developing it. So if they test you and they realize there are little signs there, here and there, which you're trying to control, sometimes you can develop everything that goes with cancer. If you are diagnosed with prostate cancer and other members of your family have been diagnosed with breast, ovarian, or pancreatic cancer, that puts you at risk for prostate cancer. So all of these are genetic risk factors because some of these gynecological cancers, having family history, can put other persons at risk for these cancers also, like breast cancer, ovarian cancer, and so on. So these are genetic risk factors. So I want you to think of all of what I have said now and, put one and one together like they say and ask yourself a question as a man. Do you think now that I should come in and do early screening and to detect whether I'm at risk for prostate cancer or not? It has to be you wanting to come in and do it. We cannot force it upon you. We cannot force it upon you. And also, when you are diagnosed and you get sick with prostate cancer and you come to our facilities, you cannot force it upon us to give you immediate, as soon as you enter, immediate service also. Some persons, because they are sick as soon as they enter. Some other person might have a worse medical condition than them, but they expect to get services right away because they are in pain. Yes, we understand that you are in pain. We understand that you are sick, but sometimes somebody else is in a worse medical condition than you, and the doctor is taking care of that person. Yeah? Good. So, okay, you have probably your prostate and you have backache, and you sit down on the hard chair at the hospital, and you feel you cannot sit down any longer. So, you want to see the doctor now. It does not happen that way. So, think of all these issues. Think of all the concerns that you might have. Think of, assess your risk and weigh your options. Is it more beneficial to you right now to do the screening, or you wait when something gets worse, when you start getting symptoms, to see the doctor, as it relates to prostate cancer or any medical condition for that fact? So I'm hoping that persons can take all of that into consideration. I know my time is up. Yeah. All of that into consideration, and go in, speak to our nurses at our wellness centers, and let them guide you in making a good decision about the early screening as it relates to prostate cancer screening. So now that it's available free of charge, don't hesitate to take advantage of that service. All we need is your time and effort. Okay? Ellen, were you hearing all of that, right? So I've been encouraging people to come into our men's health clinic, and we are not seeing the numbers, especially the 40 to 50 years old. So come in and do the test. All right. Thank you so very much, Erlan, Rome, Jan, for helping me out this morning. Soufriere FM. I really appreciate it. And again, I really appreciate feedback from community members so we can improve the show. So I'm hoping that I am going to see more men at our men's health clinic, and taking advantage of the services that are available. Again, everybody have a wonderful day and enjoy the rest of your week.